my name's Dr. Caryn McFall, and you're watching the Ask Dr. T show. Today we're going to talk about our weight loss programs that we have at our offices. And today I have with us Caryn McFall, who's in charge of the weight loss program. She's an RN and she's had multiple, how many years? How many years have you been doing this for?
2011.
2011. And this is like the first interview she's done online, and she's got like stage fright going on, so this is going to be really fun. Her hands are sweating. You know, she's gone through about 400 tissues already. Anyways, we also have behind us, who you can't see, Rebecca, who's going to be drilling us with questions on the different programs. All right, let's get started.
Welcome.
Thank you.
So here, I'm already taking over. So let me just ask first, maybe you should just give a little background on yourself. You know, just like an elevator speech on like, okay, so you're an RN, right?
Yes.
Registered nurse, and you've been doing this for how many years?
I've been doing this since 2011.
So she's been working with weight loss with these different programs we're going to talk about for a long time. Had any success?
Lots of success
Okay.
with all three programs.
Okay. And just out of curiosity, what is one of the things that will cause someone not to have success with these programs? Like, what is there like one major thing that you would say?
Absolutely. The accountability. Accountability is huge. Huge.
Okay.
So when people know that they've got to come in, get on the scale, and be accountable, that is a game changer for people.
So they have to come in every week?
For 2 of the 3 programs, yes.
2 or 3 programs. And
Yes.
a weigher, they come in and they have to be weighed?
Yes.
And then, like, is it public? Like, is it like, does everyone see the number pop up on the screen, or is it like?
No, you'll be with one person, Louie. Louie will get you on the scale, and you'll get a printout, and that printout will give you a bunch of information, and we'll go through that too.
Okay.
And that helps you to see why maybe you didn't lose as much as you thought, or that you're losing too much muscle, or
Yeah, that's not a good thing.
It gives you a good idea of how you're doing week to week, and people like that. We compare that from week to week, what you're doing.
And we have a specific type of, it's called an in-body, and what it does is it tells you more than just your weight and your BMI. It tells you your total fat composition percentage, total muscle mass. It tells you ratios. It's a great machine to compare over the weeks to see how you're improving.
Yeah, because sometimes people will come in and they'll say, you know, I've only lost 2 pounds. What's going on? My clothes are so much looser. It should be more than this. And I can take a look at, your water percent is way up. What did you eat yesterday? Oh, I had a lot of salt. Okay, well, and let's look at your fat percent, and let's look at your fat pounds. Oh, your fat pounds really went down, but your water pounds are up a lot. So I know you've lost more than what the scale is saying. So give it a couple of days, ease up on your salt, and you'll see the true result.
Yeah, plus if you're building muscle weighs more than fat, so you could not lose weight, but you could be losing inches too. So it's really nice to be able to see that on this machine too.
And if you're sore from doing resistance training or any kind of exercise, your body needs that extra water to repair that muscle. So you are going to be higher in water weight.
Okay, well, that's a good introduction, I think. So maybe we should start getting drilled with some questions.
Okay, so let's go.
That's Rebecca, by the way.
What are the 3 programs that we offer?
So we have 3 programs. One is the HCG program. The other is low carb. And then the third one is a traditional diet. The HCG uses a hormone for 40 days. It's actually a 3-month program. The first 6 weeks you use an injectable on your own.
Needle. It's a very small needle.
Very
small.
small. I've never had anybody say they couldn't do it. It's very easy, and I teach you how to do it yourself. You take those syringes home with you. But it's the first 40 days you're losing at a minimum of a half a pound a day. The men lose a pound a day. That's typical.
Not fair.
Not fair.
I like to do husbands and wives, and see the dynamic between the two.
Do they ever split up?
No,
No? Oh, okay.
but the wives get pretty angry.
Men always have it easy.
Yeah.
What is it?
So 40 pounds in a 40 pound in 40 days is typical for a man. A woman loses at a minimum of 20 pounds to usually to 28 pounds in the 40 days.
It's not bad either.
No.
It's really great.
You get a fat burner shot at each appointment. You get a body composition printout, and you get handouts, so you know exactly what you're doing. There's no question. Plus, I'm available for any type of question anytime in between appointments. And people, at least in the first couple of weeks, they always have questions. It's rare that a person, a newbie, doesn't have a question about what they're doing, because they want to do it right. The dropout rate is very low because people feel good when they're doing this diet, and they
have success.
They have success. So they're
and they
so
have success.
so I might edit that part out, I might not.
Yeah, please.
So the thing is, so they're doing injections, they're doing shots for a total of 40 shots, right?
Yes, yes.
And then there's a specific diet associated with that. And then afterwards, there's like a 6-week period where the whole goal is not necessarily to lose weight, but to like maintain that weight that they're at, that new weight, so that your body's like gets used to it. It's like a new base for you, so you stay at that weight.
Yes,
right?
because two things that I really like about HCG, besides that you lose quickly and it's very reliable, is it creates a new set point. And a set point is a weight that you've been at for years. Typically it takes to create one. And your weight can go up or down, but it wants to go back to that number. Well, we want to create a new set point, and so it's more likely to stay there. Or if you gain a little bit, it'll want to go back down.
Right.
So that is done during the last 6 weeks. You hold real steady within 3 pounds of your last injection day weight, and that will create the new set point. The other thing I really like about HCG is it preserves lean muscle mass. Lean muscle mass drives metabolism.
Unlike the semaglutides that are out there, where you lose about 40% of your muscle mass when you start losing weight.
And that's not good.
No. Yeah, HCG, it specifically burns fat. It doesn't burn muscle, which is really nice.
People don't lose muscle. And what you will notice too when you're on the diet is your energy goes up, your mood goes up, your sleep gets deeper, not necessarily longer, but deeper. Aches and pains go way down, if not away. I've had people say, I haven't felt this good in years, and it's so nice to see people when they come in the first time. A lot of people, if they're in advanced years, they're really achy, and just the way that they're gingerly sitting down, and they get up. But by the next time I see them, they have a smile on their face. They're feeling so much better. Your cravings will go away. You have increased focus.
Sense of well-being. I've seen I couldn't say what percentage, but I'm thinking maybe 40% will say they have a sense of well-being. They feel good on it. They want to do it forever. I'm like, nah, sorry, you can't do it forever. Okay. It's like a temporary thing. It's not like not something that you have to do for life or should be doing for life per se.
Right. You get immune to it after 40 days.
Yeah,
that's why it's cut off at 40 days.
Right.
Great.
And then should we talk about the diet?
Why don't you talk about the 2 other programs?
Okay. All right. Which one first?
So the low carb?
The low carb.
Sure. So we'll talk about the low carb diet first.
Okay. So the low carb diet is you're coming in weekly. It's a month long, so it's 4 visits. Typically, people do it for 2 months before they feel really confident about what they're doing. We put you on a less than 20 grams of total carbs a day. That puts you in ketosis in about 3 days. And again, your energy goes up, your mood goes up, your sleep gets deeper, you get a good sense of well-being, cravings go away, your appetite goes down, aches and pains go way down, if not away.
Now, can a diabetic do the low carb diet?
Yes, they can.
It's probably
but
better for them.
yes.
Just wondering, because I've even diabetic 1 and 2 or either or.
Medications would probably have to be adjusted at some point.
Okay,
Well, yeah, because if you go from not eating any carbs
right.
to, so if you go from like your normal diet, if you're diabetic, and you go from cutting out carbs, and if you're on insulin or if you're on some kind of medication for your diabetes, you may not need it, or you may not need as high of a dose. But that's something that you would follow up with your practitioner about too.
Yes.
Okay.
Great.
And then the other thing too is HCG. HCG can also lower your blood sugar. So if your blood sugars are a little bit on the high side, they may go down while you're doing the shots.
Awesome.
So the
Okay.
low carb diet, people typically lose about 3 to 5 pounds a week. That's pretty typical, men and women.
Equal. Okay.
Yeah,
Not bad.
equal.
And then the traditional weight loss.
Traditional weight loss program.
The traditional weight loss, we typically use the low carb diet. We don't really count calories. We count carbs because carbs are the issue. So we put you on, you're only seen about once a month. Or later on when you get stable, more stable, once every other month. But we put you on 30 to 40 grams of total carbs a day. If you're less than that, we need to see you weekly. But it's a low carb diet again, and you will still get into ketosis and have all those benefits of being in ketosis, which is again, better sleep, better mood, increased energy, all those things. So also being on low carb, your hunger goes way down. So we introduce intermittent fasting because that's a great way to keep your weight down long term.
What is intermittent fasting?
Intermittent fasting is using a portion of your day to consume your meals. So
How much? What portion?
Within typically an 8-hour period, 6-hour period.
That you eat during that period of time?
Yes, correct.
So like I could eat from 12 to 6 or 12 to 8 and the rest of the time I'm not eating.
Yes, you can have tea, coffee, or water.
Okay, that's intermittent fasting.
No cream in your coffee, no artificial sweeteners even.
Right.
It's just tea, coffee, or water. And even some teas are forbidden. So
Well, if they have caffeine, can they have caffeine?
you can have caffeine,
Okay,
yes.
okay,
Yes.
No, go ahead.
And the traditional diet, a lot of times we use ephedrine too, and that's an appetite suppressant. It makes you feel fuller faster. Just keeps your appetite down.
Any
Gives you
side
energy.
effects?
Pardon me?
Any side effects?
Yes, there's side effects. The most common one is probably headache, constipation.
Yeah, plus, like Phentermine, aka Adipex, it's, if you have high blood pressure and it's not controlled, it's not something that we necessarily can use. Other things that you could get with that medication is anxiety for no reason, heart palpitations, feel like you drank 5 Starbucks coffees. But, this is something we're monitoring, so if you're on that, we're also going to be monitoring your blood pressure, and we're going to ask you to do that at home also.
Yeah, and somebody with cardiovascular disease is not a candidate
We're
for
not
it.
going to use it.
Hyperthyroidism, nope. Glaucoma, a history of drug abuse, or pregnant or nursing moms, nope.
Okay.
Okay.
And we use the lowest effective dose, and it depends on how long it takes you to lose weight. After you stabilize and you're at a weight that you feel good at, we will reduce the dose because we never stop it just like that, because that causes rapid weight gain. We taper down, We decrease the dose, stop the dose, and if you need to get back on it once or twice a year, or some people may need it long term, because weight issues don't go away. I don't know anybody that has lost weight, had to lose weight, lost weight, and never had to deal with it again. It's a lifelong issue, unfortunately.
Yep.
That's why it's called
Yep.
weight management.
So, can you guys discuss the HCG diet and the first 6 weeks of the program?
The first 6 weeks, you're seen every week. You go on a less than 500 calorie diet. You get all the paperwork that shows you exactly what you should do. There are lotions and shampoos and deodorants and toothpaste, things that you do have to change up that can interfere with this. But it's very specific, it's very strict. You don't go out for dinners. You prepare all your own meals. You have to look at the calendar and make sure this is the right time for you to do it.
Right, don't do it just before Christmas.
No, that doesn't
Or
work.
just before going on vacation.
Yeah, I've had people do that.
Or relatives coming to visit.
Yeah.
Not a good time.
Your
No.
in-laws, right?
Yeah.
No, not at all. So that first 6 weeks, you're losing a half a pound a day at a minimum. The men, a pound a day. And you're less than 500 calories.
Less than 500
Ooh.
calories.
Yeah,
Whoa.
but your appetite goes way down. The first week, it's a little tough. The first 3 days, actually, you're gorging on high-fat foods.
Right. Right.
You're-
Does your appetite go down because the HCG causes satiety?
Yes.
Oh.
It doesn't mean that you won't be hungry. You have to get used to feeling empty. It doesn't mean that you're hungry. It's a different feeling. It's just a different feeling. The first week, though, sometimes people do want the phentermine to help them transition easier. So we can do that for people if they're a good candidate for it.
So when you're burning fat and that fat is circulating through your blood before it gets out of your system, your brain sees that, and your brain, it causes that word again, satiety. It causes you to not have an appetite from that being in your bloodstream. That's one of the reasons why you can handle being on a 500 calorie diet.
Yeah,
Right.
you wouldn't be able to do this diet
Without the HCG.
without HCG.
Yeah,
You just wouldn't be able to do it.
Right.
And if you
Right.
did do it, if you were somehow able to do it, you would lose the same amount of weight, but a lot of that weight would be muscle
Yeah, you
mass.
lose muscle.
And you don't want
You don't
that.
want that. Absolutely.
So the second 6 weeks then, that is used to create that new set point I was talking about. And you're on a normal diet. When I first started doing this, people got really confused and scared about what to eat. I don't know what to eat. So we do give them more direction, but the bottom line of that second 6 weeks is you want to hold steady your weight within 3 pounds of your last injection day weight to create that new set point. That's the whole purpose of that second 6 weeks, is to create that new set point. So typically what we tell people, you can have whatever you want, but they still need direction, but no sugar, no starches. You can have whatever you want. So they still get pretty nervous about what to eat because they've done a lot to get the weight off that first 6 weeks. So we typically tell them 5 proteins, 4 veggies, 3 fruit, and up to 2 dairy. That's what you eat in a day. And this too helps you to figure out, oh, you know what? Whenever I have that fruit, I notice that I gain a little weight. Not necessarily the 3 pounds, but I keep gaining weight. Okay, well, maybe fruit isn't your best friend.
Right.
Maybe you need to pull back and long term go more towards veggies than fruit. So, and it also is a good time when you're reintroducing foods to see if you're sensitive to foods. Because if you are, those are going to promote weight gain, and you want to stay away from them or manage it in a way that you can.
You're doing pretty good for having stage fright. You know, and I know what you're thinking out there too. You're thinking this is a lot of information. This is like
It is a lot
way
of
too much information. There's no way I'm not going to remember all this right off the top of my head. But that's why we have Caryn. She's the expert at this. She knows all this. She's been doing this for years. And you can communicate with her. You can email, talk to her if you have questions. We're going to go through all this with you as many times as it takes so that you just understand what we're doing. And I just wanted to throw that in there. And then what else? What else do we need to talk about too?
When is a patient not successful?
Typically, they're
We kind of like said one thing earlier too. What was it? The one thing?
If they're doing too much exercise and they're holding on to water or salt,
Not eating the right foods?
not
Following the
recording,
program?
yes, their macros are off.
How about hormones? Does hormones play into this?
Yes, actually, like when on the HCG diet, premenstrually, you can expect a stall, but there are ways around that. So,
Yeah, and the original author though, like if you're on, HRT or if you're on thyroid, the original author back in the 1960s, he would take all his patients off their other hormones. No HRT, no thyroid, nothing, while he was treating them with the HCG weight loss program. We don't do that though. That's a little too, I'll just say intense, because most people don't want to go off their hormones. So we're leaving you on, if you are on HRT or thyroid, you're staying on those hormones, and then we're adding this on, and I haven't seen any problem with that. Have you?
No, but you are to stop all over-the-counter meds.
Sure.
Except for aspirin. You can have aspirin.
Oh, can I take my fish oil?
No.
Oh.
No.
No fish oil. Why? Because it's a fat, and we're trying to burn fat. We don't want to throw extra fat in there during the HCG diet.
Right. The bariatric physician that I worked for was, before I got there, he introduced the HCG diet, and he started people on fish oil, and they weren't losing.
Oh, yeah.
They weren't losing like they should. So we stopped it, and they started losing when they knew what to do.
But you're going to guide the patient through that, correct?
All the way. Yeah, all the way.
And we have some great cheerleaders here.
Hand holding.
Yes.
There's a lot of hand holding on the HCG diet.
Yes.
Low carb is easier. The traditional program, those are the people, typically they know what to do. They just need accountability and support. And maybe just a little refresher. But the low carb, that program is for people who really want to learn how to eat better, because it is about the carbs.
Yep.
Okay.
Yep.
So how do we get started? If a patient's interested, what do we do? What's our steps?
Well, you either email us at drthelpdesk@gmail.com, or you can call us 248-302-0470, 248-302-0473, and set up an appointment. And we can start out, it can be a telemedicine appointment, it can be a telephone call to talk about it, or you can come in and see us.
And what is the cost for the evaluation or the
I
consult?
don't think we charge anything for
There's
the
nothing for
evaluation.
Awesome.
No.
Nothing for the consult.
No.
No.
What is there to
Should I
lose?
start charging
Besides
people for that?
weight?
No?
No.
No, okay, all right, yeah. No, so we don't charge anything for the consultation, but there are fees for the different programs. But, we're not going to go through that right now.
Right.
Call us and they can go through that with you, okay?
It's so better for your life.
What's better for your life?
Losing
Being
weight,
with us?
being healthy,
Yes.
all of the above.
Oh, yeah, all
Being
the
with
above.
you two.
Bingo.
Life is great.
I agree.
All right.
So again, any other questions, you can call us 248-302-0473, or you can email us at drthelpdesk@gmail.com. My name is Dr. Carey Tapuzian. This is Caryn McFall, and behind us is Rebecca. And take care of yourself by seeing us and calling us. Bye now.